Okay, take it away.
Okay, let's see. My name's Christy Honecker. I live in St. Albans, West Virginia, and I was diagnosed with MS back in April of 2017. So I'm coming up on 6, 7 years now. So I started with some optic neuritis, lost some vision on the left side after a headache, and through very quick action, met Mrs. Melanie Ward, and she got me fast tracked to being a normal MS person. So she got me on Ocrevus, and I've been on it since, and everything has been absolutely fantastic. I feel normal. So I'm not sure. I don't have a lot of symptoms to tell you guys about, other than my journey feels normal so far.
Christy, that's actually part of the reason why I thought of you as like a good example because, as we all know very well, lots of people do have a lot more trouble with symptomatic issues and delayed diagnosis and, damage accumulating that can't be undone at that point in time. But I think it's also really important to highlight people who are doing amazing like you. So especially, nowadays that's what we get to tell a lot of people with newly diagnosed MS. And I think sometimes yeah, we hear more about the sad things, which are legitimate and appropriate and real and big impact on a lot of people's day-to-day functioning, but it's not always like as like catchy maybe to talk to the people who are just like, yep, I'm doing great. Please and thank you. And I always tell you, like, I feel bad that you drive all the way up here to see me to be like, yep, I'm doing great. But we have a lot more patients nowadays that are like that. Again, 100% though, not diminishing the many, many people who
Sure.
don't, have that same experience.
I was very, very scared in the beginning. I didn't know what to think. I had not even heard of MS necessarily before I was diagnosed. And by the grace of God, I got you, and you took me exactly where I needed to go. There's so many new medicines. I actually had an ophthalmologist that I saw for my optic neuritis, and he was a big part of my journey also in the beginning. Essentially, just squashing all fears I had, told me not to worry. I will be walking in 25 years, so don't worry. So it's amazing the medical care that I've received, and you all have just treated me like people, and you've shared my concern, and I feel like you're on this journey right along with me, and thank you for that.
Well, another reason I wanted to invite you is because I knew you would brag on me. So, there was an ulterior motive here.
You're worth the
And it,
drive. I have to say, you're totally worth the drive. You left me, but you're worth the drive.
Yes, yeah.
I was gonna say we're recording it now, of course, so now it's on the record too for Dr. Ward.
Yeah,
So yeah, that's real.
yeah.
Yeah, that's great. Go ahead,
Yes.
Lauren.
Yeah, hi, Christy. I'm just interested to know, you mentioned your ophthalmologist and how they were also a big part of your journey. As they were initial symptoms, did they give you any hint that they specifically thought it was related to MS, or were they more interested in getting you connected to a neurologist? Can you go into a little bit more detail about what those early conversations with the ophthalmologist were like?
Sure, sure. Again, very fast track. Started with my eye doctor. She referred me immediately to this wonderful gentleman. I ended up having an MRI done, and my ophthalmologist, read the MRI and saw what he called were Dawson's fingers. So I guess him reading things, and he just gave me that initial: if it walks like a duck, talks like a duck, it's probably a duck. But you need to go see a specialist to get you connected to make sure that you are a duck. But yeah, that gentleman, he was wonderful. He was that guy that planted that initial feeling of it's going to be okay during this process. But he just saw my symptoms. Again, lost my vision in my left eye completely. And then talked to or read my MRI. And those two things he put together, he was able to say, you probably do. I'm not saying you do, but you're going to be fine if you do.
Thank you so much for that. It really reinforces the importance of multiple types of providers out in the field working with folks every day, being able to recognize those symptoms and make that referral and provide that reassurance.
Sure, and that goes back to my eye doctor also. She just started with the preliminary red cap test, testing one eye to the other to see which one. So it even started with my general everyday eye doctor. So everybody, again, they were telling me things that I almost didn't even know existed.
Go ahead, Michelle. I saw you unmuted.
What treatment have you received?
In the very beginning, thanks to Dr. Ward, got me fast-tracked. I immediately started with a 3-day steroid ball that I had. And within, I'd say 2 weeks, I was started on Ocrevus. And I've been on Ocrevus ever since. I supplement with some D3 and a Super B complex. But other than that, I could definitely eat healthier. But no, that's my only thing that I've been on, fortunately. I've never had to do anything, and Ocrevus is absolutely wonderful.
Great.
In addition to that, I'm curious as well, getting the referral and getting to see a neurologist can be a challenge and very time consuming for folks. I'm hearing you say you drive pretty far to get the expert care by Dr. Ward. What was that process like? Did you experience any delays or ways that you were kind of able to overcome some of those delays in the referral process?
As far as getting to see a neurologist?
Correct, yes.
I will say I was very, very blessed. Dr. Ward actually worked at CAMC, and my mom worked at CAMC also. So I did have a slight in to say, we have this brilliant, brilliant new doctor, and I highly recommend you going to see her. So my mom worked for neurosurgeons. So it kind of went right along in line with Dr. Ward. So I was very fortunate, and thankfully I got in through a little bit of a connection, but I've heard it's very, very difficult for others. But again, she's worth the drive.
Well, and I definitely think, there's a neurology shortage everywhere, especially also with MS specialists. So 100% that can be a barrier to care. We've tried to improve that here by we got another nurse practitioner last year. So the goal is to have more manpower to see more patients. But yeah, it is a challenge. We try to get new diagnosis people in as fast as we can, but every now and then somebody slips through the cracks, and we see them 3 months after a new diagnosis, and that's always really disappointing for us when that happens.
Sure.
And what I always say to patients, for those of you who maybe giving patients advice is again, one, if we are getting a referral for a new diagnosis of MS, in general, we try to be really good at getting people in, but sometimes there's a little bit of a wall there in terms of the referrals don't come directly to the physician. So sometimes someone gets scheduled in first available, and that's 3 months. I always tell patients, and this is really for anything, if they get an appointment that's booked farther out, call a couple times a week to look for cancellation slots, because there almost always are things opening up, a couple times a week. So for those of you who are talking to patients, suggest that to them. Probably not call 10 times a day, because that may make the front desk a little frustrated, but a couple times a week is completely reasonable in my opinion.
Go ahead, Lauren.
Yeah, if you feel comfortable, Christy, can you talk a little bit more about the medication that you take? What form does that come in? Is it a shot? Is it a pill? Do you pick it up at your local pharmacy? Is it mailed to you?
All the above, all the above. Well, when I first started Ocrevus, I was doing it in the hospital. It's an infusion once every 6 months. At the beginning, I would say it took about 5 hours. I went to my local hospital, sat there, hung out for a few hours, got some steroid, a little bit of Benadryl, and had a really, really nice little spa day. It was great. It was great, but super, super easy process. My body has handled it beautifully. Obviously, I've had no side effects that I know of. And I guess 6 years later, I am now up to doing the rapid infusion. same process. I just get to drip it a little bit faster. In fact, I just had it, oh gosh, last Friday. So I feel fantastic. Got my little juice up. But yeah, just every 6 months. I'm terrible at remembering to take pills. I don't want to inject myself. And I've had absolute phenomenal successes with it so far. And I would love to stay on it for forever. But it's a good one. Yep, just super simple, super easy. You get a little bit of your own personal time because you're off work for a few hours and just get pampered while you sit there and drip.
So,
Can I
oh yeah, go ahead, Michelle. Yep.
can I ask? I mean, I don't want to dive into what type of insurance or anything, but I know like with commercial insurance, there's copays and stuff like that for something like Ocrevus.
Mm-hmm.
Do we know what those copays are?
My copays depend on the insurance. I can't remember what mine is exactly, but they've got a really great drug supplemental program called Ocrevus Copay. It comes with a little credit card, so anything that my insurance doesn't cover short of mine, I mean, I don't even have to pay the $0 or the $5. My insurance, other than, like I said, my deductible, anything that they don't cover, the Ocrevus Copay program covers it. And it's, of course, you have to have commercial insurance to get it, but it's taking care of everything the whole time. I will get a bill for $17,000 or however much. And I just call them and they load the money onto my card. And they have been a breeze in this whole process also. They really, really have been. They have been advocates just like everybody else has for making this happen and keeping me on schedule. So it's been really nice.
That is wonderful. I work in the Medicaid world, so they don't have to worry about the copays, but yeah, of course, I am someone who would have commercial insurance, so that's
Sure.
interesting. Thanks.
Yeah, sure, of course.
Go ahead, Eric.
Yeah, just piggybacking on the Ocrevus part, a lot of our patients are on free drug, which you need to have some sort of insurance for, and they do a really good job with that. And then the copay card is really excellent. I'm kind of surprised they're still doing it, honestly. I mean, Ocrevus has been around since 2017, so there's going to be a point once it goes generic, if I think we might end up in a lot of trouble, and it may get a lot more complicated. Multiple of our drugs, when they go generic, they actually become more expensive for each patient. So it's a challenge. But I think each infusion is, I think, $50,000. So it's not really a out of pocket kind of thing. It's rough, but there are some newer versions that came out, and there's a clinic guided injection that's going to be coming out fairly soon, within the year, I think, of Ocrevus. So just a different version to sort of keep adapting and hopefully keep costs down for each patient.
And to your question, Michelle, about cost, mentioning the per infusion cost that Eric just cited, that previously could get a little bit expensive for patients on Medicare if they were on that drug or any similar disease modifying therapy, but the new out-of-pocket cap that's going into place on Medicare will definitely help with that. And there are some similar patient assistance programs like the copay card for commercial insurance that can help to offset some of those costs as well.
And the cost of these drugs is just outrageous in general. Even the stuff that's been around since the 90s and has been generic for 20 years or more is over $30,000 a year. Like, it's just ridiculous. But thankfully, with some of the copay system, that's why we rely so much on the new drugs and the copay. It really helps us.
Christy, do you attend any support groups for MS or engage with others that have MS in the community in any way?
I really don't. And I don't know if that's because I don't feel like I have MS. I don't feel like I almost belong. But I do. just short of the Facebook groups that we all get in, the Ocrevus groups that we support our drug and support how we're feeling. Support about through Facebook is about it. Those groups are, I mean, they're out there and they're vital and they're active. Between diet tips on how to improve yourself in that fashion, mental health tips, and inspirational stories about people that are bad with MS, but they're still living their lives. So I don't participate probably as much, but being able to observe and see someone else's story is really, really nice. Gives you a little bit of peace inside.
How did you find out about that Facebook group?
Definitely good. Just getting on in there searching. I knew I wanted to be in the groups. I knew I wanted to see what was going on, see what everybody else was going through. And people were very open with our story because we want everybody to learn. Because it's definitely something, again, I had never really, I mean, I'd heard of it, but surely did not know what it was capable of or what it was not capable of. It's not capable of taking all of these things from us like we were so afraid. The only MS person I knew, she was totally bedridden, and that's what I was afraid of. And to see all these people on Facebook that aren't is pretty awesome.
How did your like friends and family react when you told them about your diagnosis and about the fact that you were going to have to go for these infusions every 6 months? Like what kind of questions did they ask you? How have they treated it?
You know, they super supportive. I've got a very small family, so I've got a husband and I've got a brother too, but I've got a husband and a mom, and that's pretty much it. My mom still comes with me to every single appointment to see Dr. Ward. So she comes to hang out. My support is there. They are on my page. We are all very optimistic. We know that this disease is not going to take me. It's not going to cripple me. We're going to be fine for a good long while. So we almost, again, act like I don't even have it because we forget that I do. And then the infusions are great. So they handle all of that. They were there for all their questions. And it's just kind of a normal everyday life. Like I said, like it doesn't even exist.
That's really tremendous, the support you have with your family, as well
Mhm.
as finding the online support and
Sure.
speaking to people living with MS, just knowing other people. And as you mentioned, seeing the varied experiences and learning from each other is
Absolutely.
terrific. With this program, we really are outreaching and trying to get to those frontline healthcare workers and community organizations to better inform them of the needs of people living with MS, as well as gaining the confidence to do some care and treatment and understand the needs of an MS patient. I'm curious as to what your experience has been like with your primary care provider, or maybe any recommendations you would have to primary care providers about understanding your needs as a patient.
My primary care is an older gentleman. So he is very, very versed. He's a military doctor. So I feel like he's a very knowledgeable person, and he has just been supportive. Dr. Ward knew about my MS and everyone else knew about it. So my poor primary care didn't almost get a chance to know before I had already gone to someone above him a little bit. But he's been very, very supportive. He's a wonderful, wonderful man, but he trusts Dr. Ward's care. He monitors me. But again, unfortunately, I'm terrible for a candidate. I don't have a lot to monitor, I don't think.
You're terrific. You're terrific. Absolutely. Thank you for sharing. And
Sure.
Christy, I don't remember off the top of my head, who is your PCP?
His name's Dr. Ronan. He's
Okay.
down here in the valley. His
Okay.
valley.
So, Christy, I have a question and this was brought up a couple of sessions ago about some of the symptoms and things like that. So you mentioned like you had kind of the headache with the blindness in your left eye. So I'm assuming obviously you took action right away when something like that happens. But did you feel like, was there anything about it coming on? Because I think I think Dr.
Yeah.
Seacrest mentioned this last session or something like that, some of it can be pretty short-lived. And so things might go away and you might think everything's okay, but then they come back, so just kind of getting your perspective on that part of it.
I would say if there was ever an indicator, it was a bout of lightheadedness and a blackout almost back in December. I was Christmas shopping and it was fine. But what really hit was I started getting a mild headache. I was actually flying to somewhere in, I think, California. And I felt like I was getting cold the second I stepped foot on the plane. And by the time was leaving, I had an eye doctor appointment because I was starting to lose my vision. But during that process of being gone, I had an excruciating headache at the base of my neck that would not go away. Nothing would make it go away. And then I started losing spots of vision on my left side. And then by the time I was at home, it wasn't totally gone, but it ended up getting all the way gone. But there's no other indicator that I can remember or think of other than that little bout in December. But when it hit, it hit within a week. And my vision was gone. Nothing else. No lameness or anything else like that. Just my vision went, including light and all of it.
Thank you.
Sure.
Any other questions for Christy?
Hi, Christy. Thanks for sharing your story. I'm just interested more about is there any regular exercise regimen that you do to help support your MS care? Thank you.
I'm going to be honest, not as much as I should, like a normal person. But I am active. I do, on my days off, I do like to hike. I bike when I can. As far as daily exercise, no, I don't. I do work. I'm a retail merchandiser, so I do move around the store and I am physically active at work. I don't sit behind a desk, thankfully, unfortunately, thankfully. Um, but as far as regular exercise, no. But I'm an outdoorsy person, so that's probably about as much as I qualify for.
Yeah, I think we all can relate to that.
Yeah,
That's a great
we could all
comment,
be.
Lauren. Yeah. Anything else for Christy? We don't want to keep her too long. We appreciate you being here, Christy, and,
Oh,
and
of course.
please, you are a great patient from what it sounds
Oh,
like. Just meeting you, don't sell yourself
thank
short
you.
here.
Oh, you
For
guys are
sure.
great. Thank you. I'm sorry I'm so boring and don't have a lot. Hopefully, I will never have anything else further
That's
to
right.
tell you guys about this. I'm
I
still planning
always
on being normal.
I
Boring is
always
good.
tell my patients who are like you, who come in and drive 2.5 hours to tell me everything's fine. Thanks. Have a nice life. Let me get out of here, is like, I feel bad about that, but that actually would be the goal for every person in our clinic, to be very, very boring. It's good when you are a
Absolutely.
boring patient.
Yeah.
I love
Plus,
coming
that
in and
means
just
we just
talking.
get to talk about life for 25 minutes.
Yeah,
Absolutely,
there you
which
go.
is beautiful. Beautiful. That's my favorite.
Yeah.
It's the best.
Go ahead. I see Eric, you got your hand raised. Go ahead.
So, Christy, do you think that the interval between the medications, like the doses, does that play a role in just basically not having to think about the disease?
Yeah, I guess it would. I mean, if you don't have that daily reminder of medication, it's a beautiful thing. All you do is get juiced up, once every 6 months, and you don't ever have to worry about taking a pill. You don't have to worry about even an every 8-week injection, something getting mailed to your house. It really does, again, makes you feel normal because you're not thinking about it every single day. You don't feel it at all. Some days you feel like, okay, I feel messy today. But 95% of the time, unless I've had a cocktail or a bad night's sleep, I'm feeling spot on.
Juiced up. I love that. That is great. That is such a great term. Juiced up. No, Christy, we cannot thank you enough. We really appreciate it. Again, I know we had weather last time we were supposed to meet, and it was crazy in West Virginia and all this stuff. So I'm glad it finally worked out for you to join us.
Me too.
Yeah, and just thank you. Obviously you're connected with the right people here, with Dr. Ward and everybody. So yes, thank you again.
I'm keeping her. Thank you guys so much. It was absolutely wonderful. It's good to see everybody's faces.
Thank you very much,
I hope
Christy.
everybody has an amazing day. Dr. Ward, I'll see you, and gosh, not for a few months, but I'll see you soon.
All right, be in touch. All right, bye.
Bye, guys.
Bye. All right. Well, I think, with all that's, with the patient perspective. I know we were supposed to kind of have the second half be around PT. I don't know if anybody wants to chime in on PT stuff or just maybe what we want to have covered. We can take suggestions now, but we'll have a short session today because of that, because of not having that PT part. But we'll hopefully have it in June here on our next session in June 5th. But if anybody has any comments right now, we can take them. We've got obviously some time, but I also don't want to hold people up. So, yeah.
Can I ask a
yeah.
quick question?
Sure, Michelle.
Dr. Ward, is Ocrevus your first line of defense now, or what is the treatment plan as of now for anyone?
So it's very variable and kind of all, and then Dr. Seacrest can weigh in on this too for sure. But a lot of it depends on like the individual patient situation and like what risk factors does someone have from immune suppressing medicines versus are we not so worried about suppressing the immune system versus what other medical problems do they have? What other medicines are they on? There are kind of a lot to take into account. And you also would find different practice patterns based on who you ask. So there's like definitely no one size fits all. When I'm seeing like a new person with MS, like relatively straightforward, no other big considerations that would impact our planning, I do usually use the class that's in that Ocrevus is in first. There's a bunch of different medicines in that class, and like essentially there's not enough difference to like worry about pointing out those specifics like in this meeting, but that is my kind of go-to class of medicines if all other things are equal.
Yeah, I definitely agree with that, especially the younger, healthier folks early in the disease. We have pretty good evidence that treating on the more aggressive side with highly effective medications early makes a big difference in the short term, the medium term, and the long term. There's still two big clinical trials going on right now to prove that. I think a lot of MS treating providers are already very much on that bandwagon. Yeah, usually go for kind of the B cell class, which includes Ocrevus and some other drugs. Really, the biggest thing for me is if your disease is really advanced already and there's already a lot of disability, then the risk is high. So the benefit you're going to get from something like that is probably pretty low, and you could really hurt people. And then if someone wants to get pregnant in the near future, that's another consideration. Might try something else first and then probably transition after delivery. And that's the kind of key we tell everybody is we want you to live your life. We will adjust around you. And that's what we do our best to do. But I've probably prescribed almost all of the MS medicines for at least one person at this point. So there's a case for all of them.
Ocrevus is the most widely prescribed MS medicine in the world, though currently it's been given. The last number I got was like over 250,000 patients, but that was like a year or two ago. So I'm sure it's significantly more than that now. But that class of medicines really, I mean, I think were like pretty big game changer in terms of effectiveness and relative safety. So in the class of like the most highly effective MS medicines, there are other options that can come with more long-term side effects that we have to worry about. So like, again, there's a risk with everything for sure, and we shouldn't take the risks of medicines lightly. But in terms of like availability to get widely, not as much longer term concerns, like I really think they were huge game changer in the world of MS treatment. But again, as Eric said, every person's different, so there's no one size fits all.
Anything else for the good of the group? Any other questions or comments or anything like that? Okay, we'll get working on next session for the PT discussion. or we'll also have a backup as well if need be. But so more to come on that. But appreciate everybody attending. Thanks for a lot of great questions, interaction with Christy. That was great. Dr. Ward could not have requested a better patient to kick things off with. So kudos to you. That was great. It was really good. So
I'll put a comment
Yeah.
in the chat about something that I would love to hear PT touch on,
okay,
and maybe you could just copy and paste it or whatever.
perfect. Yep, I can do that. No problem. All right. Yeah. And if there are any other suggestions that you might think of just along the way, please email me. Let me know. We want to tailor it to make it, as best we can. So, yeah, don't be shy. Please let me know. All right. Well, I will hang on here and wait for Dr. Ward's suggestion, but everybody else free to go. Get some 20 minutes back, which is always appreciated, right? So have a great rest of the day, and we'll see you in a month.
I'll just email.
Okay. Sounds good. Bye-bye.